Hi everyone, I'm Kent. For those of you who came in a little late, I'm one of the directors of the film, along with my co-filmmaker, Marion Cunningham. I'm just so happy to be with you all today. We finished this film during the pandemic, and so we haven't done many in-person screenings. This is one of a handful, so thank you all for being here. So I want to achieve two things with you all today. The first is to guide you through the new science that's been published since we finished the film. There's been a big change. There's been an explosion of scientific interest in this topic, which is really exciting, and it's showing how it's moving more from the fringes into the mainstream. Secondly, I'm going to offer a guided exercise that will bring some of these concepts from the screen into the room. But before we get into the science, I'll tell you a little bit about my story, because these mind-body principles really have changed the course of my life. I came down with chronic pain when I was 22 years old. I developed a burning, aching pain in my right arm after a day of heavy weightlifting. You might not peg me as the weightlifting type, but I was hitting the gym pretty hard. That pain spread to my other arm and into my fingertips. The doctors diagnosed me with tendinitis. They recommended physical therapy and opioids. But after months of trying these things, I was getting worse and worse, and I had to drop out of college because I couldn't type my papers. I had to move in with my mom. As you can imagine, no college student wants to move in and live with their mom. And, I was really at a point where I was worried that my body might never get better. I might be sort of disabled forever. I had some pretty dark days. Then I read a book by Dr. John Sarno called The Mind-Body Prescription. What really got me about the book, it was his emphasis on resilience. He explains that the body has evolved over millions of years to heal from an injury, and that when pain persists, it's rarely because that the body's still damaged. Instead, it's usually that the brain has learned how to produce the pain because of fear, anxiety, stress, or trauma. Dr. Sarno says you can overcome the symptoms by recognizing that the body is safe and strong, by reducing fear, and by processing emotions. This was such a hopeful message, and it immediately made so much sense to me. I was able to recover the next day. And trust me, I recognize it's a little rare and kind of weird to be one of these people who reads a book and has this immediate healing experience. But here we are. I decided to make this documentary because I wanted to know if what worked so well for me could work for other people. And that's what led me to set off with cameras to film with one of Dr. Sarno's proteges, Dr. Howard Schubiner, who you saw in the film. This film was finished and premiered at the Austin Film Festival in 2019. Since we premiered the film, Dr. Howard Schubiner and his colleagues have continued to publish groundbreaking research. And I think it's so important to highlight these studies because despite what many physicians think, this is not a woo-woo treatment. It's based on cutting-edge neuroscience, and it's been verified as one of the most effective treatments for chronic pain in high-quality randomized controlled trials that have been published in some of the top peer-reviewed journals. If that sounds like a lot of jargon to you, it's just a way of saying that for nerds like me, there's been a lot of cool stuff coming out. So one study that was published last year in the Journal of Pain, it takes a closer look at chronic back pain. The physicians reviewed MRIs, they took careful histories of 222 people that were coming in to see a doctor in a clinic in Louisiana. These patients were not interested in the mind-body treatment. They weren't interested in neuroplasticity, right? They were there for the standard treatments for back pain, that is injections, medications, and surgery. Does anyone have a guess of what percent of them ended up having a mind-body or neuroplastic condition? Is anyone willing to hazard a guess? What? Oh, you didn't say it. Is anyone? Yeah, go. 75%? Okay, high number. All right, I like it. Anyone else want to guess? 90%. So, yeah, it's 88%. 88% of people had a mind-body or neuroplastic explanation for their chronic pain. And just for clarity really quick, mind-body and neuroplastic, those are interchangeable terms that different practitioners use. Of the remaining people, 5% had a structural pain from damage in their back, and 7% had a mixed presentation, so a combination of neuroplastic and structural damage. So this is an astonishing fact. At least I find it astonishing. I'll let you guys feel however you want. Seems like some of you already knew about it. Kind of an impressive guess you made. It's important to note, though, that this doesn't mean the patients had clear MRI scans. So 90% of those with a mind-body pain had disc bulges. 82% had osteoarthritis, right? 47% had disc degeneration disease. But those abnormalities did not explain their pain. As we saw from the film, it's very common to have scary MRI findings but no pain. And these findings are what Dr. Sarno calls normal abnormalities. So that's a pretty dramatic number. 195 people out of 222 have neuroplastic condition. And I want to give you a sense of how they reached these conclusions. After ruling out a clear structural injury like a tumor, an infection, or a fracture, they used this new assessment tool that Dr. Schubner created. You got a little sense of it from the film, but it's much more detailed. So the 3-minute scenes in the film are actually 3-hour conversations that we had to really simplify to make sense in the film. So I'm going to flesh this out a little bit for you. I personally think that this diagnostic tool is something actually everybody should learn and know how to apply for themselves, because we all get physical symptoms from time to time. And it's just hard to know, is this a mind-body thing? Is it related to stress, or do I have damage and I need to go get it checked out medically, right? It's very hard to know. And sadly, I can say, of the 8 doctors I saw for my neuroplastic condition, none of them helped me figure out that I had a mind-body or neuroplastic condition. It's not something that's taught in medical school, and 20 years later, after I've recovered from this mind-body condition, it is still not taught, not understood by the vast majority of doctors. So you guys are going to be on the cutting edge. If you follow along with me, you'll know how to use this tool. The tool is called the F.I.T criteria, F-I-T. So it involves looking at your symptoms and trying to assess if they are F for functional, I for inconsistent, and T for triggered. So I'm going to ask a series of questions that doctors using the F.I.T criteria would typically ask. And I invite you to use these questions for yourself, or maybe a past condition you've had, or if you can't think of anything going on for yourself, you can imagine a patient or maybe a friend of yours. Asking these questions can be uncomfortable, but I think it's really important to bring these uncomfortable things out into the open, and it's a way of destigmatizing my body conditions. Even though my body conditions are so common, they're still heavily stigmatized. And I think when we can talk about them, it's good. You know, with my own neuroplastic arm pain, I had it myself. I had a mind-body condition. I'm not to blame. It's not my fault. I wasn't imagining it. I'm not crazy, right? It's human. It's a human condition. So, the first category in the F.I.T criteria is functional. Functional is a term that doctors use when they do a search for some kind of damage or some kind of disease process and they don't find anything wrong, despite people having real physical problems. So here's the questions. You guys ready? Did the symptom persist after an injury would typically heal? You can ask that yourself. Ask that of yourself or imagine a scenario. Did the pain or symptoms spread to other parts of the body, or did they grow larger over time? For my thing, I had pain that started here, then it spread down here, then it went to my other arm, right? An injury doesn't spread usually. If I injured part of my arm, it wouldn't go to the other arm. Does my symptom move around, like up or down the back, or from side to side? It's really common for people to have pain up here, and then weeks later, the pain might be down here, then it might go back up again. That's a sign of neuroplasticity. Structural damage doesn't work like that. If you have GI or bladder issues, did a doctor come in and say, we didn't find a disease, we didn't find anything wrong? If the symptom is in a symmetrical pattern, like both hands, both arms, both legs, that's a really common sign of neuroplasticity. And then it's also important to note that there's a series of diagnoses that when doctors rule out a structural damage disorder, they'll give you the name of this particular condition, and it very likely, if you have been given this diagnosis, that it's a neuroplastic condition. So I'm just going to list those conditions: fibromyalgia, migraines, tension headaches, POTS, burning mouth syndrome, long COVID, ME, CFS, or chronic fatigue syndrome. Those are diagnoses doctors resort to when they rule out structural problems like multiple sclerosis or rheumatoid arthritis or other things that are physical damage problems, cancer, things like that. Okay, second category is inconsistent. When you have a structural injury, the symptoms tend to be relatively consistent. A sprained ankle will hurt every time you take a step on it. It won't stop hurting on the weekends or when you're on vacation. Not so with neuroplastic symptoms. Right? One of the funny things about them is they're kind of context dependent. They can be funny. People can wake up with really severe pain in the morning, really severe back pain, and then in the afternoon they have much less pain. Why? Someone who gets hand pain every day from typing at their job, right? They'll have hand pain in the evening, and they associate with typing. But then they'll have hand pain on Sunday evening when they have been typing or using their hands all day. Aha, maybe notice some inconsistency, right? So here's the questions for inconsistency. Do my symptoms vary dramatically because of the time of day? Do they have a delayed onset, meaning do they occur after but not during an exercise or an activity? You go running and then you have foot pain the next day. That's a delayed onset. That's a sign of neuroplasticity. Do symptoms get worse when you think about them or when someone asks about them? Like when someone like me is asking you guys all these questions. Lastly, we have triggered. Triggered refers to when symptoms are brought on by some kind of stimulus that makes your brain afraid. So the doctor would ask questions like, is your symptom worse when you're going in for a medical test? Is your symptom worse when you're visiting an annoying relative? Is your symptom worse when you're attending a social gathering? These are not things that would typically impact or make a big difference for a structural damage condition, but they can be very different for a neuroplastic condition. Is your symptom triggered by merely imagining an activity? That is scary. So if it's someone with back pain, just imagining bending over can sometimes trigger the pain. Or if you have hand pain, imagining typing will sometimes trigger the pain. That's a sign of neuroplasticity. So I'm curious, that's F.I.T. criteria in a nutshell. I'm curious if anyone in this group, as they were listening to the questions I was just going through, did anyone get a different vantage point on their own symptom or their own body? I'm seeing in the lab here. Anybody? Yeah. It's a powerful series of questions. So I haven't had a chronic pain problem in 20 years. I use the F.I.T criteria probably every month on something. Some little thing comes up and I'm like, what is that? It's neuroplastic. Do I need to see a doctor or not? And I just go through the questions. I have them memorized by now. And I have to say, it saved me a lot of time and money. It costs a lot of money to see a doctor. It takes a lot of time. And if you get good at distinguishing neuroplastic from structural damage, it will save you a lot of time and money. Okay, I want to stress that these criteria, they can be really helpful, but even if your symptom exhibits none of these characteristics, they can actually still be neuroplastic. There are many examples of people with a really steady, consistent symptom that's based at a location where there was an injury, but then when they take on the mind body healing work, they find that their symptoms resolve. So it's really important to say that because the F.I.T criteria is just a starting point for exploration. All right, so I'm pretty impressed that many people guessed this 90% figure, 88% of chronic back pain, but you guys are in the minority. Many people would respond to that by saying 90% is neuroplastic, you're saying that doctors can't help me, you're saying there's no medical treatments I can do, what am I supposed to do with this information? What a depressing study, thanks so much. And that's where my second study comes in. So we reviewed the cutting-edge diagnostic procedures, and I want you to know about the cutting-edge treatment for pain, because the numbers for those are equally jaw-dropping. This next study was published in JAMA Psychiatry in 2021. What they found is that when they randomly assigned people to receive 4 weeks of pain reprocessing therapy, the 66% of them who had had back pain for an average duration of 10 years became pain-free. There is no other treatment for chronic pain that sees anything close to those results. One person in the study who was a former football player who had a history of multiple spinal injuries was able to fully return to all the activities that he loved, and now he's happily riding a bike up and down mountains. So I want to acknowledge that studies like these, they only go so far. They can be a little abstract, maybe a little boring, but that's why I want to offer today like a guided exercise. I want to connect you more directly with some of the emotions that you saw in the film. I want to try to bring this from the conceptual into the visceral, bring it into the room with us. So this next practice is called getting in touch with your anger. Don't worry, we're not going to throw any chairs. It's going to last just 3 minutes. And if you don't want to do this exercise, that's totally fine. You don't have to participate. Anger for most people is a very scary emotion, right? It's a feeling that many of us downplay or try to ignore or try to hope will go away. We submerge our anger without even knowing that we're doing it. And submerged anger, as we saw in the film, is one of the main causes of pain, fatigue, sleep disturbances. If you're anything like me, you have a certain way of dealing with anger. I call it squashing it. It comes very naturally. Is there anyone else who squashes their anger? Okay, seeing some nods, not just me. So when somebody does something that hurts us, instead of realizing like, oh wow, I'm really angry, we often kind of talk ourselves out of it, right? We say things like, oh, I'm not that angry, plus that person's so difficult, they'll never understand. I'm just gonna keep it moving. Like, it's fine, it doesn't matter, I'll just keep moving, no big deal. And we sense this energy of anger as you're pushing it down, denying it. That energy goes somewhere, right? We ignore it and dismiss it at our peril. We ignore it and dismiss it and we wonder, why are we having so much trouble sleeping? Why are we having this pain? So with this exercise, we honor the feeling of anger. I want to invite you to find sit in a way that feels comfortable right now. Make yourself comfortable. If you feel comfortable doing this, I invite you to close your eyes. We're going to go for just 3 minutes. And I'm just going to guide you in an experience of this. These questions are not so much to answer with your intellect. You kind of want to ask these questions of your body. Just drop them in and see what happens. So take a moment and think of an incident in your life where you feel like somebody hurt you in the last 6 weeks. Don't pick the most dramatic thing or something really intense. Pick something that feels approachable. And bring that moment to mind. Some kind of conflict, somebody you care about did something disappointed you or hurt you. Just remember that. Remember how you felt in your body. Remember where you were, maybe where you're standing or sitting when that interaction happened. And then pay attention to your body. How are you feeling physically, the direct physical sensations? Most people, when they are hurt, they notice tension. That's the dominant feeling, tension. So you might feel some tension in your chest. That's good. You just want to notice it. Be curious. You don't need to get rid of it. Just notice the physical sensation of tension or maybe tightness. See if you can take a deep breath through the tension. And now we want to reach past the tension into the feeling that's underneath the tension. So anger triggers anxiety, it triggers tension, but it is not the tension itself. Anger is something deeper, more profound. So you want to reach through the tension and invite that deeper feeling into the surface. Anger is more likely to feel like heat. You might notice your heart quickening. You might notice some twitching in your legs or your hands, some muscle strength there, right? Anger is something that is protective, protects yourself or protects someone you love. So you're reaching through this tension, setting the tension aside, and allowing yourself to connect with the felt sense of anger. If there's anything that anger wants to do, it's good to acknowledge that. The anger may want to stand tall, it may want to project your voice, it may want to hit. Right? It's safe to notice this in the quietness of your mind. It's not going to hurt anyone. The desire to hit's not going to hurt anyone right now, right here. It can feel threatening, but it's actually more threatening to deny this and ignore it. So wanting to protect yourself is a positive thing. Then we want to ask, what would anger say? Now that you've connected with the felt sense of anger, what does it need to say to protect you, to protect a friend? Sometimes it's simple, right? Sometimes it's like, don't do that, or that hurt. Don't do that again. Imagine yourself saying this to the other person, what feelings are coming up. Speaking with anger, drawing a boundary. And then sometimes when we get in touch with anger, we feel a mixture of other feelings coming up too. There might be some guilt, some remorse. Maybe you don't feel like you acted to your standards. Maybe there's some regret or heaviness or tears coming up. You can make space for that as well. Getting in touch with anger often gets us in touch with our guilt, with the heaviness, and it's important to make space for that. So now we're going to conclude the meditation. You can open your eyes, reconnect with the world around you. If you notice any change in your current symptom, like your current pain or other symptom, that's useful to recognize. Often when we feel really angry, maybe our back pain is like 10% what it usually is, right? Then you're seeing a connection between anger and pain. But that's not true, just like with the F.I.T criteria, it's not true for everyone. Sometimes there's no obvious connection, especially when you first approach it. But regardless, everyone can benefit from being more comfortable knowing when they're angry and expressing it in a healthy way once they've spent some time with it. Okay, so that is the end of my talk. So next, right now we're going to start the Q&A portion. We just have 5 minutes for the Q&A, but if you want to ask me more questions, I'll be available outside during the resources fair. So before we start the Q&A, I just want to acknowledge everything I've talked about today and what you saw in the movie is all very controversial, right? This is emerging science. It's not hugely accepted yet throughout the medical world. And so I just invite people to bring their skepticism, pointed questions. I'm very comfortable with that. I welcome it because it can often clarify what we're talking about. So yeah, and then before you ask your question, there's going to be a microphone that Dr. Brady is going to hand to people. So does anyone have any questions for me?
I have a friend, for instance, who she gets long COVID. How much of that have your studies, if anything, have shown that's in the mind or what?
Yes, that's a great question. So the question was about long COVID and what studies exist for long COVID being a neuroplastic condition. So the studies that exist are minimal. There's one study I know of. It was done by Dr. Mike Donino at Harvard. And it's a small study. I think it's it's definitely less than 30 people, and there was no control arm. But the study found it was very successful. I think it was significant recovery, like 50% reduction in long COVID symptoms across all the different long COVID symptoms. The reason why people in the mind-body world feel comfortable saying long COVID is a mind-body symptom is just because it fits with so many things like fibromyalgia. It fits with the idea that people have been checked out medically, they've not been found to have lung damage or heart damage and so on, and so they say, okay, you have long COVID, which is kind of a way of saying we're not exactly sure why these symptoms are continuing. We haven't found damage that explains it. And the same is true of people with fibromyalgia. They have pain that moves around their body, they have trouble sleeping. They commonly also have irritable GI disturbances. And when long COVID people come into clinics where people practice mind-body medicine in this way that we've been talking about, there's significant recoveries. And I can just say from personal experience, I've worked with 3 people who've had significant recoveries from long COVID. So you're correct that there's not a huge amount of science yet. And it's sad to say that the NIH, which has $1 billion to study long COVID, guess how much went to looking at the neuroplastic amount? 0. right? They're only looking for molecules, they're only looking for biomedical solutions. And I don't even think they're allowed to study psychological interventions or mind-body interventions for long COVID. I think that's a tragedy personally, because as far as I know, it's one of the only ones that's been shown to work really well for people with long COVID. Anyone else have questions? Yeah.
The problem with the transfusion worldview is that you can end up saying like, oh, your illness is a problem of your will. How do you navigate within the mind-body framework, not ending up saying something like, oh, if this doesn't work for you, you just gotta like have a stronger will, you just need to take courage about it.
Yeah. No, I wish I had more of a philosophical background, because there's lots of great philosophical questions around dividing so neatly between a structural damage problem and a neuroplastic problem. And you didn't ask about that, but it's a fascinating thing. And the rhetoric is not perfect still, right, that I'm using. But I might have, how do you not convey to people that people have a weak will? And honestly, it's a problem. It's a problem, and it's an individual, it's a one-to-one thing. And sometimes I'll work with somebody for 6 weeks as a coach, and then I'll hear them talk about it as if this is their fault that they have this symptom. They hadn't talked about it or seemed to be thinking that way at all. I always say at the beginning, this is not somebody's fault. It's not something you're wanting to bring onto yourself. It's not a conscious choice, of course. But then when they feel like if there's no clear medical reason for me to have this thing, then why do I have it? I must want it. It must be. And that's where it's nice to be somebody who's had it yourself when you're helping somebody, because it's just so clear. Like, I know I wasn't at fault for having chronic pain. I know I didn't decide to have it. And can you hear that coming from me? That acceptance that this is something that happens to people rather than a choice. And then you're saying, if they don't get better, is it a lack of will? It's a tricky thing, right? Because this isn't a treatment that you can give somebody like a pill and it either works or it doesn't. Somebody has to decide to do this treatment, and they have to do work. They have to do inner work. And not everyone can do or has the resources to do inner work. And so you hear sometimes criticism coming into the mind-body field of like, be careful, because this is never going to work for everybody, which is true. Some people who have ME/CFS, they're in bed rest, they have they can't experience any stimuli without really severe symptoms. They can't engage in a dialogue, so they can't use the mind-body treatment, at least at this point in their lives. And so it's easy to be like, you're blaming them, you're saying that they have this because it's some fault of theirs. And I think that's where it comes into like, this is an unconscious process, right? I didn't choose to have pain. It just happened to me. And I was lucky enough that I was able to take the steps to do mind-body healing. Not everybody doesn't make sense to everybody. They're not able to always follow through, and that is never somebody's fault. It's just there are constraints and difficulties and its complexities. Yeah. Thanks for the question. It's a great question.
Hi, Kent. My name is Yala, and I'm actually an alumni. Currently live in San Francisco, but it's good to be back. I just have a couple of comments. I'm a fibromyalgia survivor, and I struggled with chronic illness for almost 30 years, and was really losing the ability to use my body and becoming completely bedridden. And I just want to say thank you, because this documentary played a really critical role in my healing journey. And I think for me, it really came down to developing that honesty with myself and going inward and really confronting those deep, dark aspects that I have been consciously and unconsciously repressing for so many years. Yeah. And so I really feel like in order to heal yourself, you have to know yourself and be honest with yourself. So that was a significant shift. And just watching this documentary again, what I'm really thinking about now is like, yes, this is about chronic pain, but it's so much bigger than that, right? It's about what it means to be human. And at some point, we're all going to grapple with these really difficult emotions, whether it is grief or guilt or shame. And 80% of people will experience mind-body symptoms at some point. So it's kind of great to be able to see that come through. So thank you so much for being here, and I'm excited.
Yeah, I just want to respond really quickly. My gosh, this is the response. It's just special to be able to be in a room and interact with you directly, right? I worked on this film since 2011, and when we finished it, we weren't able to be in rooms with people and have these conversations, and I didn't ever have it, not that it's about me, but I didn't have a chance to hear your story, people like you and your stories, and I know there's so many of them that happened because we distributed the film remotely, so I'm just so touched to hear that. It means so much to me, like I'm gonna cry, you know? Because emotions are okay, right? I could really cry like hard if I let myself right now, and maybe I will later, and I hope we have a chance to connect and chat afterwards. Yeah, thanks for sharing.
Hi, Kent. Thank you so much. I'm Candace Goldsworthy. I'm a former professor of speech language pathology at Sac State. I'm skeptical as a lifelong back patient. I don't want to go too far from my eyes back, and I still have tramadol in the medicine cabinet. But I think this is brilliant, and I have been trying meditation and some other things, and I think the hard part is to stick with the alternative approach, because when pain starts happening, it's hard to have this talk with yourself and to call it something else because it's so real and debilitating. But I think this is brilliant, and and thank you for your work on it. I have two questions.
Okay.
When and why, I guess I have, that first question has kind of two parts. When, why, there I'll do it that way. When, why can something like this be on Netflix or Prime Video, or, not that I'm not demeaning your local efforts because I so appreciate it, but, these kinds of programs to have the publicity and the stage, the platform of a Netflix or I'm just mentioning those two. I'd love to see something on a much grander scale as you spread the word. My second part is maybe something more for Dr. Peretti or Ken Chipper, and that is I feel disappointed now because a little disappointed. I'm also very happy to have experienced this, but to know where some local resources are.
Excellent.
Is something like this happening here? I want to go out to a table and find somebody's card. Oh, good. Oh, good. Thank you so much. I'm so glad. Thank you for your work. This is brilliant.
Thank you for acknowledging your skepticism, and that's real, and it's the point of view of the vast majority of people with chronic pain. Just you're in good company, and it makes perfect sense. This stuff is totally counterintuitive and really hard to wrap your head around, and it's also not for everybody. This is the truth of it. As far as the Netflix question, we did try to get on those platforms, and they did not want the film. So if anyone knows the CEO of Netflix, tell them to change their minds, go for it. But we actually are really happy with our self-distribution system. Like, it's been going for 4 years now, and look where we are. Like, I get to be in this room with you all. About the local resources, I just want to mention we have an amazing physician who's here in the room with us, Dr. Roeder. Would you mind standing up for a second? So Dr. Roeder does this exact type of therapy that you saw in the film. She's a psychiatrist and she's an internal medicine doctor. So like, she can check you out physically. She can check you out. She can work with you on mind-body stuff. So she has an amazing experience. She's based in Palo Alto, and she has a booth here. So you guys should feel free to talk to her if you're looking for local resources. And the other thing is, there's also a lot of thanks for standing up. There's also just a lot of remote abilities to connect with practitioners online. So if people don't want to leave their home, there is a lot available online. And you can find those out on our website, thismightHurtFilms.com. You can flyers. Yeah, we have flyers outside with a bunch of resources and all the citations from the studies I referenced. And I just want to end by thanking Dr. Robert Peretti and Dr. Joyce Michael Flynn. Thank you so much for having us. It's the world.